we have three panelists who are going to speak now with a little bit more focus and depth on some of the transition challenges. And to start, we have Santiago Cornejo. Santiago leads the financing work at the Gavi Alliance and has great credentials in financing because he also has worked at the World Bank. So I'm joking on that, but it always helps in terms of our collaboration. So Santiago, over to you.
Thank you, Tim. Thank you for inviting me to provide you a little bit of a brief outline of Gavi's experience on transition and sustainability. When we look at, in the context of the Gavi countries, countries tend to face various programmatic and financing challenges along the different stages of the development continuum. If we look at income, the lower income countries tend to have weaker systems of health systems and immunization system foundations and more acute fiscal constraints. As they grow, they build stronger systems, but they still have some institutional gaps in key areas. They have growing domestic resources, but perhaps inadequate allocative efficiency and prioritization. Further along, they tend to achieve many gains, but these gains are still at risk. And also there are missed opportunities for broader impact in terms of efficiency and impact, health impact. Now, what is important to note is that these categories are not absolute, meaning countries fit in these categories along in many stages in this continuum. Also, what is important is that when we look at the Gavi countries, we're seeing that in our first wave of countries, we saw a little bit of this model in terms of continuing development. So in this context, what we look at, we have evolving needs that require evolving type of engagement and support. When we look at Gavi, the early engagement is about building those foundations for sustainability. Later is preparing the countries for transition, and then it's about this post-transition engagement that helps to solidify the gains. We have different tools. We have health system strengthening support. We have targeted technical assistance. And of course, for the low-income countries, we have a fixed low co-financing level. Later on, we continue with our health system strengthening, but this health system strengthening diminishes the support in terms of recurrent activities. Also, we introduce transition grants to help with targeted support for those areas that are required for transition. And since there are more resources, there is a growing co-financing requirement. And as countries already transition, what we have is more targeted support to mitigate those risks. We have some additional support for more continued transformation of the health system, and of course the issue of pricing or access to pricing. Now, when we look at this, our eligibility, transition, and co-financing policy provides institutional framework for Gavi's engagement. We use GNI as our indicator. It has with its pros and cons, but this is what Gavi is using in terms of the GNI indicator. But also this policy serves as our key mechanism for domestic resources mobilization and, of course, the financial sustainability, as we will see. So in Gavi sustainability, what is important is financial sustainability, but also programmatic sustainability. Domestic finances are very important, but they are not enough. We need to look at the programmatic sustainability as countries require critical capacities for planning, for budgeting, for procurement, etc. Also, we need to integrate sustainability in the design of our engagement. What do we mean? It's about sequencing the support, addressing the systems from the foundational issues early on, adapting our support to the country needs, but also to reflect the transition phase. For example, what I mentioned before, not supporting the recurrent activities as they are at the final stage of transition. And of course, it's about leveraging the system. As Tim mentioned, we are currently in Gavi, we have 25 countries that have either transitioned or are in the process of transition. So we provide some results, findings, lessons from these countries. And here you have the countries in this map. Basically, those in green are the ones that we have already transitioned. Sorry, it's very small. I thought I would have a bigger screen. And those in light blue are those that we're still transitioning. And basically, when you summarizing the results and findings, we're seeing that the transition model for Gavi, for immunization, has been quite successful. However, that doesn't mean that it has not been. There are challenges, and it's not easy. When we look at coverage, immunization coverage, what we see, and here you see countries before and after Gavi was created, that countries are transitioning with high coverage, either they're increasing or remain high. There are some countries that are not. However, these are low conflict, post-conflict countries that have started with very low coverage. If we look at the case of Angola, that had a coverage of 19%, now it's 64%. Still not good enough, but we are seeing some increase, and I will come back to that later. Also, in terms of Gavi support, of course, introducing new vaccines that are very cost-effective, that save lives, is critical. And we see here how some of our countries have introduced many vaccines in the process of our transition. We have countries that have introduced out of our package that includes pentavalent, pneumococcal, rotavirus, and HPV, most of them in the Latin America and European region. And then, as I mentioned, domestic resources being critical, what we see, and this graph is showing the increase in domestic resources from countries to purchase those vaccines through our co-financing mechanism. And here you can see some countries, for example, that in the 7-year period, if you look at countries like Honduras, Guyana, Moldova, or even Congo Republic, they have increased their allocation from less than $1 per child to around $20 per child. These are domestic resources that are being mobilized to purchase vaccines. So in terms of the findings so far, what we can see, at least in the Gavi context, is that the fiscal capacity is not the key bottleneck or the main challenge for transition, at least in this first wave of countries. Yes, in terms of financing, there are other challenges, particularly the capacity on budgeting, planning, execution of those budgets. And of course, also there's a broader financing challenges of the sector. And Tim mentioned some of them, for example, in terms of out-of-pocket. But those are not related specifically to the Gavi transition, given that those are things that Gavi is not financing at the moment. In terms of performance, generally high performance from these countries. However, there are some gaps in terms of some countries, if you have seen in the previous Gavi, that they have not introduced the full package of these life-saving vaccines. And for this, now the Gavi board has adopted a new policy to help introduce vaccines for these countries. And also we have a small subset of countries that do not have high coverage. And these include these post-conflict countries like PNG, Congo Republic, Timor-Leste, Nigeria, and Angola. For these countries, we are looking at tailored approaches, given the specific context of these countries are quite unique. One of the key challenges is these institutional capacities. Even though they're high-performing countries, with high coverage, we're still seeing gaps in terms of regulation, procurement, supply chain, data systems. Also, some of the concerns around transition in this country is losing the supportive environment of being part of an alliance. And what we're seeing, some of these countries are seeing some new challenges like the anti-vaccine movements. Also, there are concerns given that Gavi supports through our mechanism of technical assistance, our technical partners, WHO, UNICEF, the World Bank, that they will be losing that technical assistance. And of course, being part of the alliance also helps to keep immunization high in the political agenda. And this is the reason why the board has decided that this post-transition engagement is critical, which is not about financing per se, but continuing being part of the alliance. It helps to mitigate some of this risk. Finally, there is also greater realization when we look at the development of the health system that it's not just about national, but it's also the issue of subnational authorities and entities, which means that it requires that we need to engage with a wide range of stakeholders. In the case of Gavi, we're not just talking about EPI managers, but the Ministry of Health. We're not just talking about Ministry of Health, but also Ministry of Finance, not only national, subnational parliamentarians, but also working across the different partners. An example is the partnership that we have with the World Bank. 3 years ago, when we started this process of transition, we look at the need to establish this Gavi transition, even though it was from immunization, within the broader health transition. So we are partnering with the World Bank to really do this assessment in terms of looking at the broader transitions of health, of which Gavi is one of them. And perhaps one of the areas where there is a great need, and in this first wave of countries we have not worked as much, is the involvement of civil society, communities, and private sector. Now, But Gavi has had a significant experience with engaging with private sector. It is within our DNA. And our engagement ranges from the financing to also leveraging the expertise. And this range is what is important when we look at in the context of this transitioning countries. Also, when we look at the areas that we have been engaged in the private sector, there are many of these areas where we have found some gaps in terms of institutional capacities. Let me give you an example of supply chain. We are working together with UPS and FIT, which is a regional private sector. This is to help improve the supply chain to deliver to the last mile. What is this? And this is the work that is being done in Uganda. The key lessons of this engagement is there are two, I think, that we need to keep in mind when we think about transition. First, that it takes time to build these partnerships with the private sector and to move it to scale. And that's why we need to start early on. Second is that it's critical to invest and also leverage regional and local private sector too, particularly in these transitioning countries where there are many opportunities. So in terms of important lessons, I think one is that when we look at the sustainability, it's not just about financing, but it's also about programmatic. And when we look at transition, as Tim mentioned, it's about change. So there are uncertainties, but also should be seen as an opportunity. Change is an opportunity, but only if these transitions are planned early and there is an early engagement and early planning. It's critical to address some of the systematic foundations early on, these institutional constraints. Also, it's important that this transition needs to be a progressive phase out. It cannot be a drastic or dramatic just phasing out. And in order to do that, it's critical to provide predictability and transparency. While in our policies and something that has been valued is the predictability and the transparency, also we are learning that we need to adjust a little bit and be flexible for some of those unique circumstances, unique cases that require some flexibility and to adjust our approach. And finally, is that there is no magic bullet or silver bullet. I know we have been looking for that, the solution that will fix and will help on the transition, but it's not. Actually, it's about getting the basic rights. There is no substitution for appropriate planning, appropriate budgeting at all levels, and this is critical. And also, when we talk, and this is very important, when Tim was mentioning about, for example, about out-of-pocket, how do we have those systems that can really look at those resources and take advantage of the resources? Also, it's about prioritization. When we look, it's all about prioritization, which that means and refers to the governance systems of some of these countries. Some of our transitioning countries, even though they are in the early stages of that epidemiological transition, they're spending 2/3 of their budgets on tertiary care. So it's how do we help improving the decision-making and the governance of these countries. And for that, what we need and what is good is a wide-range engagement of stakeholders. This is not about one program, it's not about one sector, and it's not just only governments or partners, it's really including every partner available. Thank you very much.
Thanks very much, Santiago, for taking us deep into Gavi territory, but also synthesizing some key lessons that I think we'll come back to in the discussion.